Hello.
Hi, Senator. Thank you for joining.
Of course. So sorry about that. I was finding a space in the Capitol, so we're all settled.
No worries. Senator Persaud is on. She'll be hopping on shortly and we'll start.
I'm just waiting for you guys to connect to Facebook and then it will start.
Okay.
We're on.
Roxy, you called me when I was in the health committee meeting, but we have to thank Senator Salazar because she is taking me into her office from 124.
Okay.
Her team is graciously.
Okay, so we are live now.
Oh, great. Okay.
So, okay. Hello, everyone. Good afternoon. I am Senator Roxanne J. Persaud, representing the 19th Senate District. And today we continue our annual conversation on period poverty, period inequality, whichever name you would like to give it. This week is what's called a Period Poverty Awareness Week. And we have with us a group of panelists who will discuss with us all things period. You know, my colleagues every year when we have the resolution in the Senate, they're like, "Oh my God, all we hear is period, 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 period." And I know we saw Lauren, who my legislative director, who put this together. She came across a video with a group of young people and one of our panelists, Dr. Tasha, and who says, period, right? And so we're like, oh, and she said, let's contact them and see if we can have a conversation with them. So today we have with us my colleague, Senator Kristen Gonzalez, who's been a panelist with us before, and she will tell you who she is. And before we start our conversation, we have Aiden Garland Minor. Aiden was with us from the very first year that we started doing these webinars. And she's going to tell you all about herself and why she came into this space and why we've been partnering with her over the years. And then we have Dr. Natasha Ramsey, MD, MPH, FAAP, and she's commonly called Dr. Tasha. And she's going to tell us, yes, and she's going to tell us all about her. But first, I would like to start with my colleague, Senator Gonzalez, if she would just introduce herself and then tell us. So for everyone who's joined us on Facebook, if you have a question, please put the question on the chat, and we will try to answer as many questions as possible in the time we have allotted for this webinar. Again, it's an important webinar. But before Senator Gonzalez introduces herself, I wanted to let you know, what is period poverty? You know, half of the population menstruates. People, may not think about this on a daily basis, but this actually occurs. And we all know plenty of people who have a period, but everyone does not know that 1 in 4 people, 1 in 4 have no access or they struggle to purchase period supplies, right? Low income, whatever the economic situation is with them, and so they suffer. We have children who are unable to go to school because they have no access to the products. We've talked with youth who they would go to school and they would be afraid to get up from their seats in the classroom because they do not have any means of changing the product that they're wearing, and so they're afraid that if they get up, you never know what's behind them, and so they'll sit there, and it causes a lot of health issues. You have students who they don't go to school, period, during the time of their cycle, and so this is a way of us bringing awareness year after year so that people understand. And when we do these product distributions, people think, oh, you're just giving things away. No, it's because there are many people who are unable to purchase these products. And so we're going to start with Senator Gonzalez, and she's going to tell us who she is and just lead us in. And then we're going to go to Dr. Tasha. I'm going to continue to say Dr. Tasha because online, that's all you hear, Dr. Tasha, Dr. Tasha. And so we're going to talk with her. And then we're going to go to our Shiro, Aiden, who again has been with us for many, many years in this conversation space. So Senator Gonzalez, it's all on you.
Thank you so much, Senator Persaud. And it is such a joy to be back here. I look forward to this event every year because as a young woman myself, so much of what you just said resonates with me on period poverty. I think for all of the progress that we've made, it's still not talked about enough. And, in the context of a lot of the affordability conversations that have been happening in the legislature, we forget that just basic products, like menstrual products are still a barrier for so many families. And that's just not only families and, young students, but, that also extends to college students, to people who are living paycheck to paycheck. I mean, I certainly remember working, work, study, and, feeling that, spending $20 in order for products, I felt that in my budget. So I really just want to say, I appreciate the work that you and your office has done to raise awareness, to fight for people who menstruate across the state, and how inspired I've been by the young women that I've seen in past years join these calls, and certainly today, just what an honor it is to share the stage with these two incredible organizers and hear just what that's looking like on in local communities. So again, I just want to say thank you for setting this up, and I'll pass it back to you.
Thank you. And now we're going to go to Dr. Tasha.
Hi, everyone. I'm Dr. Natasha Ramsey, also known as Dr. Tasha. So I am a board certified pediatrician. I'm also an adolescent medicine specialist. So that means I work with young people ages 11 to 25. And that means that I have special knowledge about the menstrual cycle, periods, and all of the things that come along with that. I also have my own business called Gorgeous Sex Ed, where I create sexual health resources for young people and the people who serve them. So what that looks like is that I draw all of my own illustrations. I take those illustrations, I make handouts, presentations, and then also do speaking engagements and things like that. I've had the pleasure of partnering with the Teens Pack organization from Community Health Network on a number of period related and just sexual health related topics. So this topic is near and dear to me. When I was a teenager, I actually wrote for a teen sexual health magazine called Sex Etc. And my first article was about periods. So I've been doing this work since I was
For a
16.
long time.
So I'm super excited to be here today. This is one of my favorite topics. So if I talk a lot, I apologize.
That's okay.
But
That's
I
what
got a lot to
an
say.
hour. That's what we're here for. That's what we're here for. So Aiden, tell us how you got to this space.
Hi, folks. Thank you for having me. I'm Aiden Garland Minor. Let's see, I was trying to think about the timeline today because it's been, I think, almost 10 years. I'm coming up on 10 years of being working in the menstrual equity space. I started a chapter of Period, which is a nonprofit that aims to put an end to period poverty and destigmatize menstruation through a youth-led chapter model. So I started a chapter of Period in 2018 at my university in Washington State. And then a few years later in 2021, I started working for Period, managing our chapters in the Northwest region, and then eventually ended up managing the whole chapter network across the globe. And now I am working in education, and I actually just found out recently that I just got into grad school, so I'm about to go to grad school in the fall.
Congratulations.
Thank you.
Yes. So we're going to start our conversation. For each of you, if you can tell us from your experience, your expertise, what, in your opinion, is period inequality? We'll start with Dr. Tasha.
Yeah, so we kind of mentioned this already, but period inequality is a lack of access to products, but also information, and also systems for someone to be able to manage their period properly. So a lot of times when people think about period inequity or period poverty, they think, okay, this person doesn't have pads to be able to, change during their period. But there are people who have access to products, but there's so much stigma. They don't have enough education or information about their bodies. They go to a school where they can't get a pass to be able to go to the bathroom and change their pad. There's all these other components that go into period inequity. And so when I think about it, I think about it from this holistic lens and not just about the products.
Okay. Aiden?
Yeah, I don't think I could have said it really any better than Dr. Tasha. But yeah, I think the one thing I totally resonate with that. I used to think about it when I first started about just the products themselves. And now, especially now that I've worked in high schools and elementary schools and middle schools and, seen it on a, more direct personal level with students, think there's so much education that's also missing. Like the amount of I would say the majority of the students that I had when I worked in a high school really didn't know anything about their cycle. And we're talking at age 17, age 18, they don't know about the phases of your cycle. They don't know how ovulation works, like, which is, I think to me was kind of mind blowing. But that just only spoke to the lack of access to quality education that students across the nation are receiving, which is so important in terms of the discussion of period poverty.
Okay. And Senator Gonzalez, as the legislator, what does it look like to you?
Yeah, I definitely agree with both of the panelists and could not say it better. But from a legislative perspective, we talk a lot about what it means to protect people's rights. And so for period poverty, I think it means equality really means that we're creating a state where it is a right to have access to information about your own body and a right to access products and healthcare and support that you need in order to continue to be a healthy, happy person who menstruates and live a dignified life. And I think that's really what Senator Persaud has been leading so much on over the last few years.
So to continue on that, what do you think as legislators we need to do to alleviate the inequities that we see in this space?
Yeah, I think it's a few things. I think passing it's a two-pronged approach, right? On the one hand, we have an incredible chamber and opportunity to pass real legislation that not only can give funding to organizations that are doing this work, funding to healthcare access, and also funding to people who are dealing with poverty broadly, right? Not just in the context of period poverty, but also legislation that codifies that right. And I certainly will leave it to, I know your office has been working on some legislation, so I know I will leave it to the experts, but we're certainly supportive. But the second prong, I think, is using these offices as a organizing entity. So it's not just what we can do in Albany, it's what can we do on the ground in our districts. And that type of like using this as a platform and working with, our own constituents, I feel like is so invaluable. And so, I'm really excited to say that like we do healthcare resource fairs, and this is something we talk about. There are schools that are, when I speak to young women, I kind of bring up, I'm like, this is something I dealt with, like how are you all feeling? So I think just using our offices as a way to actually reach people and meet people where they're at is really unique, and as legislators, something that we should always be doing.
Yeah. Thank you for that. Dr. Tasha, you said you just loved speaking about this topic, right? You just love it. Tell us, is this a topic that you have discussion with every patient, or you're seeing them through that whole entire cycle? What is that conversation like? And how do you broach that conversation to ensure that they have a patient has what they need and they understand these things?
So I forgot to mention this, but I actually work in a high school. So I'm a school health doctor.
Okay.
Yeah, so I work in a high school in the Bronx. I work for Montefiore. So very grateful to them giving me the opportunity to meet with you guys during the middle of the day.
We thank them.
Yes. But yes, I work in a school clinic. And so what that means is I'm literally in the environment of the young people. And so when they get their period during school, they come down to the clinic. We can give them medication. We also have pads. We actually leave the pads in the front of the clinic so that they can access them the same way they would access condoms or a tissue. So that it removes that stigma of having to ask and whisper about needing a pad. They can just come, grab it, and do what they need to do. So from the door, from the very beginning of when someone walks into the clinic, they are seeing that periods are destigmatized and that this is a safe place. Um, During the visit, oftentimes people, like I said, will come in for period cramps. They'll come in because they just got their period. But if we see them for anything else, say they're coming in for birth control or they're coming in to talk about their reproductive health, the menstrual cycle is a huge part of that discussion as well. Sometimes we have people who have mental health concerns, and we notice that it's become cyclical. It's related to their menstrual cycle. And so they may have something called PMDD, which is premenstrual dysphoric disorder, where we connect with the therapist and we're able to help them get more support around their periods. So it is like a huge component of what I do on a daily basis as a school doctor. And it's something that even if they're not here for that, I still try to incorporate into the visits. There was paper that was published, or I can't remember if it was bulletin by ACOG, which is the American College of Obstetrics and Gynecology, and they identified a period as a vital sign. So really and truly, anyone who is a menstruator, we should be asking that question anytime they come, even if it's for headaches, if it's for nausea, if it's for ankle pain, whatever, we should be asking them about their periods because that can affect the rest of their health.
Interesting. Oh, thanks for that. I never thought of that. Right? See, that's why you're the doctor, right? So, Aiden, if you can tell us, what are some of the struggles that the biggest struggles if you've encountered while you're advocating and the things that you've been doing?
Yeah, absolutely. Um, I was thinking about this earlier, and I think in the beginning, when I was first kind of, becoming an organizer and going through that process, I think the hardest thing or like the biggest challenge for me at the time was to figure out how to get people's attention and to make them care. That was definitely like the biggest hurdle for a long time. But I think I mean, not to say that that's not an ongoing issue, that will always be an ongoing issue, but I think as I got older and I had more experience, especially publicly speaking and, learning, how to be persuasive in certain ways, that got a little bit easier just with practice over time. I think since COVID, though, the biggest challenge that I faced, especially leading the chapter network at Period and talking to other chapter leaders who were doing this work in their communities, was engaging youth post-COVID. I think that especially now that we have such a like online landscape, which of course has its pros and has its cons. And then, so many young people are growing up with so much more exposure to, technology than, for say I did. I think that's probably the biggest challenge now. It's even, 5 years, 6 years post the onset of COVID. That's probably the challenge that I have faced the most. And just from what my peers have told me, the thing that they've struggled with the most in their communities, like I think period chapter members, that was probably the question I got the most regularly, was like nobody is engaging and people are not joining clubs anymore and people are not even coming to campus anymore because they're doing school online. And my approach has just been, kind of a long game, I would say, like building relationships, doing community building and building trust. That's the thing that I found the most success in terms of engaging people, but that is hard and it does take a lot of time. That's a long-term investment. So I'm always open to hearing, feedback on what people are doing to engage their communities.
Well, thanks for that. Dr. Tasha, when you're speaking to your students, your patients, people in the community, how do you tell them that they can advocate um, for to first eliminate period inequality, product, the deficiencies that we are seeing? How do you have those conversations? What do you say to them?
Yeah, so anyone who knows me knows that I'm very big on education. And so knowledge is power. And I think it's very difficult to navigate these spaces and to advocate for what you need if you don't know what you're supposed to get and you don't know what you need. So I'm very, very big on education. Any patient who interacts with me, I always tell them you're gonna leave here with something. Like you are gonna learn something today. Even if what I'm providing you is just information and reassurance and not a pill or medication, you're going to leave here with knowledge that you can use to better your health in the future. So I think the most important thing is education, learning trusted sources, going to places where you can learn more about your body in general, about periods, about how they work, about different methods and things that you can use. It's just very important to do your research and to learn, and then to identify trusted people that you can talk to. So a lot of my patients come to me and ask me questions about the menstrual cycle. I have all these images that I go over with them, and we nerd out for like 5 minutes about like the different phases and things like that. But there's lots of online resources you can, and also I encourage people to talk to their aunt or talk to their, counselor or whoever their trusted adult is in their life. But the knowledge is the most important piece to that advocacy component.
Okay, so I'm going to ask this question from somebody put it in the chat for Dr. Tasha, but then I'm going to ask the other panelists to answer it also. What are the misconceptions about menstruation the people have, and you wish that they would understand better? And I know all of us, people have misconceptions about, oh, you hear the comments that they make. If a woman is like grumpy one day, you know what they say, oh, maybe she's on her period. So tell us about
Exactly.
it.
Which drives me crazy because
Exactly.
when you're having menstruation, your hormone levels are actually at their lowest point. So I always tell my young people, throw it back at them and be like, you don't know anything about the menstrual cycle because actually my hormones are at their lowest point, and that's why. So I think one of the biggest misconceptions, part of the reason why I went into adolescent medicine is because people don't like teenagers. They just don't. They don't like them and they don't understand them. And I love teenagers. And so I find that what happens with menstruation is a lot of people extrapolate data from adults onto teens or data from young people from children onto teens. And teens are a very specific group with their own unique needs, physiology, etc. And so oftentimes when people start menstruating, they'll talk to their parent about it or their aunt or their teacher or whoever. And they're like, oh, that's normal. My periods suck too. No, let's stop normalizing people being doubled over, vomiting, having like lots of bleeding, feeling dizzy and passing out, like all of these things around menstruation. Like, yes, menstruation can be horrible, but it really should not be to the point that someone is having these physical symptoms and having to miss school and things like that. So unfortunately, I also find this in the medical field. There's this normalization of menstruation being horrible and people ignoring people's symptoms and ignoring the signs. We need to listen to people and we need to take people's concerns seriously and then also help them come up with a solution for how they can address the issues that they're having around menstruation. So I would say that is one of the biggest misconceptions is that a teenage period is the same as an adult period. They're completely different. And we cannot extrapolate adult data onto young people. Young people have unique needs and their needs need to be heard and listened to. So that's my little soapbox.
But then there are people who say period is period, right? So yeah, we have to make sure we start ensuring that people understand what you just said. So Aiden?
Yeah, absolutely. I think, oh, the first thing that came to mind was just that, like, the biggest misconception that I've come in contact with regarding period poverty is that people think it only exists in the global South. That has probably happened to me so many times in conversations with people everywhere. I remember one time talking to a group of activists who I was consulting who were in Italy and they were grad students and they were talking about creating period products for people in, I think it was Uganda. And I was like, oh, well, we have period poverty in the United States. And they were like, what? Like, you do? I was like, I bet you have it there too. But yeah, I think just probably I've like told, I remember like so many times where I would go and speak to people and I would say, oh, 1 in 4 girls ages 13 to 17 in the United States don't have access to consistent period products. And they would always be like, oh, the United States? Like, I remember like people would say, oh, probably in like the global South. And then I would say the US, and they were always shocked.
Yeah.
So that's probably the misconception that I've just heard the most. Yeah, in
Okay.
terms of period poverty.
Senator Gonzalez?
Yeah, no, I really appreciate the stories that are being shared. And, a couple of things that are resonating with me is even as when I was a teenager, the idea that there isn't care given to how teens are different from adults, but how that normalizes the pain they are feeling. And so later in life, they don't seek care. And I've had friends and colleagues who have been diagnosed later in life with things like PMDD, but it took a long, long time to seek that care because when they were younger, their symptoms were normalized. And, I have experienced severe pain during my period when I was a teen. I remember distinctly like almost passing out on the train one day and hearing of like my aunts used to pass out. And it was completely normalized because, as Senator Persaud said, period is period. It's, oh, we all go through this and that's fine. And actually, I didn't realize that until I was older and I was able to access reproductive health care that helped manage some of the symptoms and pain that I had, that was not normal. And actually, now I'm very lucky to have managed it. And as a young woman of color too, I see very often that how we're treated in the medical system is different, right? How doctors treat us, how people respond to our symptoms. So the barrier to even get certain diagnoses is higher. And I think it just speaks to, if we cannot stop talking about this, if we're really going to solve some of the structural challenges that enabled period poverty or misinformation. And the only other thing I wanted to offer is a misconception that I have seen is that this is an easy fix. I think a lot of times folks are like, oh yeah, well, we'll just make sure that you can get it at any bathroom and then it'll be fixed, right? Like, well, and it's, in 2016, New York City passed a law that said that in K through 12, maybe I'm misciting K through 12, but in public schools broadly, there had to be access to reproductive health products. And they were actually sued for failing to comply and failing to deliver. So, it's not enough to just say, oh, well, we'll make it happen. It's still an ongoing challenge. And that's why bills like some of the ones that I know we're supporting today, there's one from Senator Hinchy to allow for SNAP benefits to purchase menstrual products. There's another from Senator Clear that requires free menstrual products to be provided in the bathrooms of private colleges and universities. Those are really important, but it's not an easy fix. Like, it's not we pass these bills and we're done, right? There's going to be a lot more work that needs to be coordinated, as we really address the broader issue. So anyway, I wanted to add that. And again, thank you all for just being so insightful here. I feel like I'm taking notes as well.
Well, thank you for that. We have a number of pieces of legislation, and sometimes it's not easy to get the legislation through because we have to manage what the federal government requires. For example, using SNAP benefits to purchase menstrual products is not something that's allowed. So all of these things we have to work with. So Dr. Tasha, there's somebody who's asking for you. Do you share education and how your diet can affect period and hormones? That's what this person's asking.
Yes, definitely. There's a very complex relationship between all of your hormones. In fact, I always talk, I like to nerd out about this, but your menstrual cycle actually starts in your brain. So your hypothalamus and your pituitary gland, they release hormones that then communicate with your ovaries, that then communicate with your uterus and tell it to build up a lining, etc. So any imbalance in any of your hormones from your pituitary gland can affect your menstrual cycle. So for instance, your thyroid gland, your prolactin is another hormone that comes from your brain that can also, there's all these hormones that are in this perfect harmony and imbalance. And so the things that you eat, your stress levels, all of those things, stress causes cortisol, cortisol is a hormone. All of those things can impact your menstrual cycle and impact the way that you experience your menstrual cycles, and even impact if you have a menstrual cycle. So for instance, if someone is malnourished, especially young people are at risk for this, because during puberty, you have a lot more nutritional requirements. Not only are you trying to survive, your body is also like, I'm growing exponentially. So a young person who's going through puberty can require way more nutrition than an adult who is already done with growing. And so your nutrition is super important. There's also different types of foods that can be helpful during your menstrual cycle. So as you can imagine, when someone's on their menstrual cycle, they're having contraction of their uterus, cramps, to try and get the blood out of the uterus. That's a normal physiological thing that happens. And those muscles require calcium, magnesium, those things. Also, when you're having bleeding, you're also losing iron. So make sure that you're having a balanced diet where you're having calcium, magnesium, iron, all of these things to help replenish and help to kind of like help with those symptoms. There's also a lot of natural things that have been found to be very helpful with something called chasteberry. There's also medication. There's also supplements called Don Quai. All of this stuff has been ginger, turmeric. It's all been like loosely studied, but I am a doctor who went to school for a long time, but I also believe in the magic of community, and I also believe in some of these. And I should mention my family's from Jamaica, from the Caribbean, so we believe in naturopathic options as well to help with managing your periods. So there's lots of information out there, but those are just a few to name that can be really helpful with managing your period.
Thank you. So Aiden and Senator Gonzalez, when you were Senator Gonzalez, you talked about the issues you were having. Did you find that a change of diet helped you in any way?
Yeah, I think change of diet is important because again, these things aren't happening. We're full people, right? Like diet impacts how we experience symptoms of things. Stress levels impact how we experience any symptoms. So it's how to take care of ourselves. And I think, I think what's really wonderful about this conversation is the more we talk and encourage young people to be empowered to care for themselves as they menstruate, that is something that will also be care and starting point carried over to taking care of themselves and advocating for themselves, knowing what it means to go online and be informed and understand what's happening to their bodies. And I hope that, that's something, I've had to learn, but I hope that it's something that we can do for all students and young people. But to your point, yes, diet and multiple, I think exercising has been another really good example. But yeah.
Aiden?
Yeah, I might not be the best at the implementation on this particular topic, but my parents are always telling me that food is medicine, and so I'm trying to do my best to learn from them. And my doctor at one point in my life did tell me that I should pursue like a anti-inflammatory diet in terms of managing my menstrual cycle and its effect on my ADHD. So I think I have more to learn when it comes to diet and menstrual cycle, and I do wish it was introduced at an earlier age. I feel like the only reason it was even brought up was probably last year when I was 26, because I was having so many problems with my reproductive health. Before that, no one had ever brought up diet and periods. So yeah, I do hope for a future where that is more integrated into our education about our cycles.
It's amazing that the things every year we do these webinars, and every year you learn something new, right? Because I don't think we've ever had in-depth conversations about diets. Because people are always asking other questions, but no one ever talks about diets and when it comes to a menstrual cycle. So here we are today. Someone is asking this question, like, hey, and so we're learning about diets and hormones, and like, oh, wait a minute. And so we're learning that today. Then so we're looking also, you know, for you, Aiden, the question is, why is it important that young people get involved in advocating for this issue?
Yeah, absolutely. Well, I always say, and I think probably the people in my life are tired of hearing it, but that youth are our future. In my experience with organizing with youth organizers, which has been the majority of the work that I've done in life, they are the trailblazers. They are typically, I find, the people to look to for inspiration. Like I'm constantly inspired by the drive they have, the ideas they have. They have so many innovative and creative methods, to do the work in their communities. So and they are our future. If I wish that I wish that Gen Z and Gen Alpha, I think that's what they're called, right? I wish they had more of the power, and I am excited for a future to see when they do, because I think if our youth had more power over social justice related issues like period poverty. I mean, I have complete faith. Like, I think we would just have fewer issues and they would be addressed at a much quicker rate than we've been able to address so far. Not to say that other people are not capable, but youth have just so much energy and they're so excited. And I do see that Gen Z in particular, I feel like, and I don't know if it's Gen Alpha, but maybe could not say that, but the generation below them, they're just so caring and they have so much empathy and awareness towards their peers and towards people unlike themselves, but from different backgrounds. So I have complete faith in the youth of this nation and this world.
Oh, thank you. So, Dr. Tasha, this is a question for you. Do you think that as a health educator, that you're breaking through the stigma that surrounds the discussion about periods? Because
Absolutely.
this is you. Just sometimes it's a taboo subject. Nobody
Yeah.
listens. People don't want. You don't want people to know. You don't.
Yes, yes. And I'll tell y'all a quick story. So like I said, I've been doing this work since I was a teenager myself. I have two younger brothers, and I'm very close with my dad. And I went on vacation with my dad and my brother to go visit family in Florida. And we had went to Walmart the day before, and then my period came the next day. And I was like, crap, I don't have any period products. And I was like, I have to convince them to go back to Walmart, but I don't want to have to talk about it. And I had to check, and this is me as like a grown adult woman having a difficult time and having this stigma around talking about this with my own family. And I was like, snap out of it. You tell everybody that they need to advocate for themselves. You got to do it for you. So I sit them down in the living room and I'm like, guys, we need to go back to Walmart. And they're like, why? We just went to Walmart. And I was like, I just got my period and I need to get period products and we need to go to Walmart. And
And
they're
they're
like,
like TMI,
okay.
TMI, TMI.
No, they were like, okay, okay. So then we proceed to talk about periods the entire car ride. My brother goes with me in the period aisle, and I explain to him all the different period products. And this is my younger brother, and he's like looking through them, and he's like, "Oh wow, this is really cool." And it was like such a moment, and I in that moment, I realized how much stigma I carried, right? Even with the education, even with all the advocacy, even myself, someone who does this work carried that stigma as well. So I think that health education is super important. We have to break those barriers. We have to break the stigma. The only way we're going to do that is by having those difficult conversations, right? So I saw in the chat that someone had asked, like, how do we, as a community,
As a
how do we,
community, that was the
yeah,
next question. Yeah, yeah.
yeah, so I just want to touch on that by saying we have to check our own biases. We really have to look like Aiden said in our own communities, right? The people that we talk to and interact with every day. Like how do we reinforce or stigmatize or destigmatize periods, right? How do we have these conversations with our nieces, with our children, with our colleagues? So how it starts with you as an individual being able to have those conversations in addition to the education and the knowledge,
Mhm.
but also like releasing that stigma and having those tough conversations. So
So, Senator Gonzalez, do you think it's an easy conversation for you to have with your constituents about um, period inequality and menstrual products, etc.?
I, you know, I think it's become easier for me, admittedly, to talk about this, and that's because of so much work that's gone into destigmatizing. And yet, I don't think that everyone is there. So I've become more comfortable, but I've also found that that comfort isn't received well and in every setting. And so, um, I want to continue having these conversations with my constituents. And I think one thing I try to remind myself when I feel some discomfort in a situation is that this is a pop like a maybe popular isn't the right word, but a unifying issue in the sense that, 1 in 4 teenagers have reported that they've struggled affording menstrual products. I think of people who are low income in the United States, 2/3 have said that they have had this exact challenge. And so, especially in spaces where it's either low income students of color, like I was once, or just really young people, it's not, there is a common experience by a large part of the population. And so, it's reminding ourselves that like this isn't it may be uncomfortable and it is very widely felt. So I'm going to hopefully come away from this call too with some new information to continue having those hard conversations.
So Aiden, how can someone start to do a collection, a period product drive? How do you suggest they do that?
Yeah, absolutely. Um, I think my first recommendation would be to just start by trying to find donations. And this can be that I've seen so many different creative ways to get donations. I mean, of course, unless you want to buy the products yourself, which, I'm not going to necessarily,
Which, yes. Mhm.
yeah, you could do that. You could do that, and that would be fine if you have the means. But I tend to think, there's like power in reaching out to our community and asking for donations, because then we have the opportunity to to talk about the issue, to do education, and then to also get more people aware of what's going on. So I think there is power in doing that, in particular. But yeah, I would just say, going in my experience and what I consulted or told young people or suggested they do is to reach out to local grocery store chains. That's something I found to be really effective. Sometimes grocery stores will be willing to donate like a large amount of products that you are not going to want to purchase on your own. I did have success doing that, maybe like especially local stores that aren't necessarily franchises in the whole nation. Sometimes franchises will. I know that the grocery outlet sometimes is willing. I've heard that from multiple people across the US that they're willing to donate products or run product drives in their stores. That's another thing, asking stores or community landmarks if they're willing to have a box and then it just says donate period products, and you have like a QR code that you can scan and explains why you're doing that. I've seen people do that in grocery stores as well. So I would say, yeah, just starting with getting donations, whether it's from grocery stores or individuals, and then just having like some sort of, whether it's like a pamphlet or just even a QR code itself that people can scan that takes them to a page that just describes why this is important. Yeah, that would be my first recommendation.
Okay, thank you. Dr. Tasha, so that this is Period Poverty Awareness Week. Does your hospital do any drives so that they can distribute products during this week?
So Montefiore is a huge institution.
Mhm.
And as with many institutions, there's a lot of different things happening in a lot of different departments, but
Mhm.
it hasn't been like centralized in a way. So I know there are some people that are working in the pediatric clinics that are distributing products, collecting and distributing products.
Mhm.
And I know the school health department, we are in the process of trying to figure out how we could further help support our young people when it comes to period poverty. But there's not like a concerted effort yet,
Effort.
but I'm
Mhm.
working on it. I
Okay,
do through
we'll
my
follow up with you on that.
yeah, so for Gorgeous Sex Ed, I do partner
Mhm.
with Teens Pack, and
Yep.
every year we host something called the Periods Summit.
Uh-huh.
And so the video that you saw was the result of the follow-up after that, our second annual summit. We are having another summit this summer, July 30th. It's open to the public. You just have to register. And we are collecting donations currently, just like Aiden said. So please help us. But yeah, so um, I don't think I'm answering your question, but we are doing things. As a physician, I am working on things in my institution and outside my institution and combining the two
Mhm.
to be able to get more products and education to young people around periods. So just wanted to bring that to light. And once again, sometimes it takes one person in the institution or in an organization or in the legislation to just really be the champion and kind of push and connect people and amplify the topics. So
Yeah.
those of
So
you out in
what
the audience, it could be you.
it could be you. Yep. Anyone can start a drive. Yes. So what we've done over the years, we've done the distributions and we'll center it around schools or different areas, and then we just go and give out of the products. Um, but yes, you mentioned a Teen Pack. Deja North was supposed to have been with us today, but she couldn't make it. So that's when Lauren had seen you guys on the video and said, "Oh my God, these are people we can have the conversation with." Um, so, Senator Gonzalez, how are you going to encourage your community to have a drive so that you can do, because it's, I think next week, there's a menstrual product day, something, I think it's next week. So how are you going to encourage your community that this is something that's important that we all need to pitch in, so that we need to eliminate the term period poverty, menstrual inequity, all of these things we need to eliminate it. We walk around and we tell people, we love to say, New York, we're like the best state in the nation, right? The United States, we're the best country, we're rich, we're this. But we have people who can't afford these products. And you hear on a daily basis. And it doesn't matter what zip code you're in, it can happen to anyone. So, Senator Gonzalez, how are you going to encourage your constituents to do a drive in your community?
I think it's like you said, it starts with us. So we'll definitely be looking for some local partners to work with us, relying on some of the hospitals. And then we have like Bellevue in our district that we've worked with quite a bit on toy drives and baby supply drives. So we want to certainly see if we can expand into menstrual products.
Yeah. It's interesting when we're talking about these things. There's another thing that people are in need of: diapers for children. So when you're doing a drive, I think you can put the two together, because it's same issue, major issue. It's that
Good idea.
someone with the products to change for during their period, they can go to work, they can go to school, they can enjoy the social settings because they don't have the products. Someone who doesn't have diapers for their babies, the same thing, right? And both issues, because of the inequality that exists within those two spaces, we have health issues. Someone who doesn't change a a pad for a whole day because that's the only one they had ends up in the hospital with some kind of an infection. A baby whose diaper hasn't been changed for the same whole day, the same thing. So if we merge those two together, we're like, oh yeah, we'll do great things, because we'll be helping improving the health outcomes in our communities. So, what else do you guys want to talk about on period poverty? You're in the school doc. You're in the school doc, Dr. Tasha. Are the schools receptive to having drives and having these conversations, or just they rely just on the students coming to your office to ask you those questions and to get products from you?
So the
Now
answer to that,
let's talk.
the answer to that is, unfortunately, like Senator Gonzalez said, there was a bill passed in 2016 that schools should be providing products to their students.
Yep,
I don't work for the DOE, right? I work for an institution that's in the
that's
DOE.
in yeah.
So we provide period products, but it really is supposed to be the school that is providing those products. Easily accessible for young people to get. I remember I had a principal come down to the clinic and he said, some of the students were talking about this, and I was just wondering, like, who's supposed to provide period products? And I said,
Hmm,
you are.
you are.
It's you. And he was like, oh, like he really had no idea. So I think, like Senator Gonzalez said, even though this policy has been passed for several years, there's a disconnect. There's a disconnect between people getting the information. There's a disconnect between people getting the products. There's a disconnect between the young people knowing that this is a right, that they deserve these things in their school spaces. There's a huge disconnect. So yeah, the period products that most people access, they get it from us in the clinic, and we're happy to provide that service and be that safe space for them. But it really does need to expand to be in the school system at large, so that young people don't have to get a pass to come down to the nurse to be able to get a pad so that they can go to the bathroom. So like it's interrupting
They're interrupting their day, interrupting their studies.
exactly,
Yeah.
exactly.
And
And then
then they're like, oh my God, everybody knows I'm going to get a.
exactly. And then another thing I wanted to bring up, which we kind of talked about, but I just wanted to highlight further because, like I said, I'm a health educator at heart, and that's where all this work started for me. There is no federal mandate for comprehensive sexual health education or menstrual education. There is no state mandate in New York for comprehensive sexual health or menstrual education. In New York City, we have a mandate. But if you're a private school, if you're a charter school that's not a part of the public system, if you're outside of New York City, it is not guaranteed that you're going to get that information that you need about about menstrual cycles and about
Mm-hmm.
your body. So I think also we need to push it a little bit, and we need to also advocate for that as well.
Senator Gonzalez, you heard that? We have to speak with Senator Webb. Senator Webb is
There
the
you
chair
go.
of women's issues. And so I know there are some pieces of legislation that talks about that. There's always pushback when we are trying to do those kinds of legislation. But it's a topic that we'll bring up with Senator Webb. She was on our conversation last year, I think it was. That she was on there. We were talking about that. And there's a question, Dr. Tasha, I think it's for you. I think there are two parts to this. Uh, hmm. Beyond the lack of products, what are the most significant mental health impacts of period poverty on students and young people? And I think both Dr. Tasha and Aiden could address that. Are you seeing the
Yeah,
question? Yeah.
I think when we talk about periods, there's also this component of dignity, right? I think Senator Gonzalez brought this up earlier about making sure that people's rights are being supported and being protected. And there's a sense of dignity that also needs to be protected as well. So like you said, the student who is sitting in class and they bleed through their clothes and now it's on their clothes and they didn't have a pad because they didn't know that their period was coming because they didn't know how to track their periods, etc. That has impacts on that person's dignity, and that creates more stigma and that creates more shame, right? And those things can directly impact someone's wellness. That can directly impact someone having anxiety or depression or school avoidance. So menstruation has a huge impact, not just like this like medical direct link between like your hormones fluctuating and you having premenstrual syndrome or premenstrual dysphoric disorder, but also just this overall general sense of wellness and well-being. So menstruation definitely directly impacts that, and the way that you're able to navigate menstruation directly impacts that. So I think, we think of these extreme cases of these people who have these, maybe mood swings or other things related to their periods, but the everyday person who is menstruating still deserves their wellness and their mental health to be taken into consideration when they're menstruating. And I think Aiden had mentioned this earlier, the phases of the menstrual cycle, there's different phases, and during different phases, you feel different ways. So there's parts of your menstrual cycle, because remember, we're always in our menstrual cycle, right? Menstruation is one phase of the menstrual cycle, but the cycle is constantly happening and you're constantly in phases. And there's parts of the cycle where you feel great, and there's other parts where you feel terrible. And like us normalizing that and understanding, like, okay, I'm in my luteal phase right now. I probably shouldn't have that really important meeting because I'm just not feeling up for it. Like, let me reschedule that to a time where I'm going to be, more efficient, blah, blah, blah. So, in general, wellness and menstrual health go hand in hand.
Okay. Aiden, you want to add anything to that?
Yeah, I really couldn't have said it any better. But yeah, I mean, how can we expect people to thrive, students to, I mean, perform really on any level in school when they're thinking about how they might be bleeding through their pants or, they're not comfortable. I mean, we're talking, I mean, I I've experienced it myself on some level, on a one day occurrence, and I will never forget that day for the rest of my life. I mean, it stuck with me until I'm 27. It happened when I was 12, and I remember it vividly, So and it was just one day, people are experiencing this on such a more systemic, level for their entire menstruating career, career. I don't know if that's the right word, but I mean, it is really feels like a job, the amount of time it takes up and the money, but yeah, I think, I mean, we just can't expect people to perform really at all, to feel confident, to feel secure when they don't have security, if they don't have comfort. Like these are basic needs like food, like water, like toilet paper that people need that they're being really denied. And yeah, that's
Okay.
yeah.
So our final question here, and I'm going to ask Senator Gonzalez to kick us off, and then each of you can say anything if you wish. As this person is asking, how can we better educate non-menstruators to ensure this is viewed as a human rights issue, not just a women's issue? That's key.
Non-legislators. Interesting. I think we should still definitely, and we are on the legislative front, making sure we're bringing everybody in. But for non-legislators, I think it is continuing to have these conversations, but also reminding everyone like we have a shared responsibility to each other and to protect our collective human rights. And that looks like teaching your sons or just anyone, even if they don't menstruate, like what it is and how to be an ally and supportive. And then also reminding them that that every institution and every person has a part in supporting people who are menstruating. And I think that that kind of, you don't have to be a legislator to do a drive and make a difference. You don't have to be a legislator to you know
To have
see
this
that someone might be
conversation.
struggling and have a pad and give it to them. And that I think I'm seeing that more in schools. So I think it's reminding we all have a place in this.
Yeah. There's this thing that people say it's for women. If you have an old handbag or, always don't throw it out. Pack, pads and stuff in there and just keep it in your car or wherever, or, in your office. Anybody comes, just give it to them, It's like, hey, here's a bag. And it always has all of these things. So I think more of that we should do. So anything else anyone who wants to say before we wrap it up? Again, it's our week of talking about everything, period.
Yeah, I just wanted to say I think that what Senator Gonzalez said is super important, that young non-menstruators, not everyone needs to be involved in the conversation. I think a lot of times that burden is put only on menstruators, and it's very important that young men, boys, dads understand how menstrual cycles work, and so that they can support the people in their lives who are menstruators. And I know this is a topic for another day, and we're about to log out, but menopause is another area because people stop menstruating, right? You're not having menstruation anymore, so now it's done. We don't need to talk about it. But that is an area that is also grossly under-discussed, underfunded, underserved, etc. And so we need to be having this conversation across the lifespan, right? It's not just about products, it's about dignity, it's about rights, it's about, understanding your body and having access to the information that you need. So I think, we have to go beyond just like the person who's menstruating. It's about the big picture. So that was my last little soapbox for the day.
Well, thank you. And so we do webinars on menopause also. Yeah, we're all around, we're always trying to do something. So thank you for that. Next time we're doing something, we'll call you on you. Yes. Yeah. Aiden?
Yeah, I mean, I was just thinking about how when you asked, like, what is the biggest misconception? Maybe this is the biggest misconception, right? That it's just a women's issue. I mean, I just think, I mean, this this really exemplifies to me how we live in a world designed for men. Because how can this be a women's issue when women, we're all here because of a woman? Like we are the bringers of life, and that is not even really brought to light how complex and difficult that is in and of itself. So I just think, period poverty affects everyone because everybody is here on this planet because of a woman who had a period at one point. And of course, it's also linked to all the other forms of oppression. It's an intersectional issue. If you don't have one resource, you probably don't have another, right? If you're struggling to pay for food, you're probably struggling to pay for period products, just everything is all connected. So yeah.
Well, thank you all very, very much. This is, as usual, every year, we're excited when we do this every year. And people, like Dr. Tasha, she says she loves talking about periods, but we love bringing the conversation and having the community involved in this conversation. I like encouraging my colleagues to participate in this, and so we can have these conversations. Tomorrow we'll have Senator Gonzalez. The resolution is coming to the floor, and so we're going to be talking about it on the Senate floor again tomorrow, talking about menstrual cycles and periods, and and then we'll be like, oh gosh, we see our male counterparts look at us like, oh gosh, here we go again, right? But this is a conversation that we have all the time, and we appreciate all of you taking the time to join us as we continue these conversations, very important conversations. And if each of you can tell people how, if they wish to contact you, how can they contact you? And if you put in your information, you can say it and put it in the chat because we'll leave it up also. If you want to make sure you're giving us the public information that they can contact you, we will ensure that the people who are asking for your contact can have access to it. And if you, Dr. Tasha, you talked about the event that's upcoming. If you send us that flyer so we can put it out there, we can publicize something that's, community activity, as long as you're not telling the people they have to sign up to join something or it's cost them money, we can't do that. But we can share the information because again, education is key. And we want people to be educated in this space. So again, Aiden, great seeing you. Thank you. Best wishes in grad school. And we'll see you again. Senator Gonzalez, thank you very much for always being willing to join our conversation. And Dr. Natasha Ramsey, thank you for joining us again today. And you can tell your colleagues at Montefiore that we say thank you. And I'll actually tell some of our former colleagues who are part of the system there that we thank them for allowing you an hour out of your busy schedule in the middle of the day to have this webinar with us. So again, thank you everyone, and we will ensure that people have your contact information and so that they can get in touch with you. Have a great day, and remember, period inequality affects everyone, it affects every community, and the conversations should not be limited to this webinar that we're in. It should be a conversation we are having across our communities. So again, thank you all very much. I'm Senator Roxanne J. Persaud saying thank you and have a great day.
Thank you so much, Roxy. Thank
Thank
you.
Thank you.
Bye-bye.
Bye, everyone.
Take care.